In support of the Go Red for Women initiative, all this month we'll be highlighting heart disease in women. Now this week I talked with a cardiologist with Sentara Health about something called broken heart syndrome. It's very good at mimicking a heart attack.
They're having pain in their chest typically, maybe shortness of breath. It may go to their jaw or to their arm. And frankly, when they arrive in the emergency room, we often think this patient's having a heart attack. We do an EKG, it looks just like a heart attack.
But unlike a heart attack, there's no blockage in the arteries. Medical experts didn't know why this was happening to young, healthy people. Not much was known about it until about 20 years ago. They called it broken heart syndrome.
It's a syndrome usually induced by stress. Over the years, I've had patients, one had the loss of a loved one, a loss of a home. One older patient I had, her grandson got into drugs and got very sick with that. But some stressful event usually happens.
The old saying, died of a broken heart, might have been truer than people realized. Intense emotions like stress, anxiety, or sadness can affect the way blood is pumped through the heart.
Normally, this heart muscle squeezes in a symmetrical fashion. But with the Takotsubo cardiomyopathy, with this broken heart syndrome, the basal portions, the top of the heart squeezes nicely, but the rest of the heart just balloons.
Taking the shape of a Takotsubo or Japanese octopus trap. The physical reaction can come days or even weeks after the stressful event. And if caught early, Talreja says patients will usually recover well.
They need medicines to relax the heart. They need to identify what was the cause of stress, and usually getting some family support or support on an emotional level to get through that grieving process and process that grief they had or stress.
And after treatment, it can take a couple months for the heart to go back to normal. Some of you may remember Debbie Reynolds died from broken heart syndrome one day after daughter Carrie Fisher died of a heart attack in 2016. Talreja says it can be fatal if you don't seek help in those first moments of feeling chest pain and difficulty breathing. Talreja says you can get ahead of it by recognizing stress factors and connecting with a support system.
Oftentimes the person who suffers from this is someone who's very stoic and doesn't want to show emotion or wants to get through it on their own and not seek help.
Now we'll have more on how to spot the signs and what you can do to help prevent it at wavy.com.